Have lower back pain and upper back pain. Have feet numbness, and my right leg is, burning the nerve pain.
Understood. And I believe we discussed this on the consultation that you had surgery.
Yes,
your low back.
L5 is one.
All right.
Two
now,
surgeries.
Two surgeries.
Yes, one in 2016 and one last year on March 6, 2018. Same kind of surgery. It was a laminectomy. So they checked the disc a little bit to free the nerve, but it's not quite, good.
Right now we're looking for is there any abnormal temperature going on, and we have one at this level. So we got a lot of muscle tightness on this side, soft on the right side. Feel that swelling right over here? Get a little speed bump right on this side over here. Another thing we also see is there's two scar adhesions over here, right? The incisions, just as you mentioned before, there's two surgical procedures done on this disc over here. And what they did was they did a microdiscectomy. And because the patient still continued to experience sciatica, numbness, burning down the right side, that's what we call failed back surgery syndrome. So the real problem we gotta identify is, how's this fellow right here? Pain? Tender, right? Yeah. Yeah, we found a little edema and swelling right over here too. Second sacral segment, but it doesn't seem to be too swollen, too bad. How's that fellow there? Tender, right? But this is worse. Yeah, and there's also more fixated too versus the second sacral segment as well. All right, so this is the one we need to address. Feel this over here?
Yes.
Feel that speed bump right between the laminas? Yeah, that's swollen over here. Feel that right there? Right between the spinous processes? Right over here? This is also swollen. This is also swollen.
Yeah, that's the pain I was telling you about.
See? Correct. And you feel all these muscle knots over here? These are all muscle spasms, tight over here, flaccid and loose over here, all to protect and stabilize this.
Yes.
Now we check for any abnormal movement. See this one right over here? That's fixated. That's not moving at all. This is the one we need to address.
The 5 things we identified was there any swelling? Was there any muscle spasms? Was it abnormal temperature? Was it abnormal movement? Right? All 4 things we identified here, that 5th lumbar is in trouble. And the 5th final one, that's what we see here on this X-ray over here. It's misaligned, it went backwards and inferiorwards. To clarify, normal movement, I want to see this. But because it went this way, see how much more movement it went? In addition to, take a look over here. This is the actual dimension of the spinal nerve. You don't need a microscope, they're actually this big, right? Because it needs to relay all that critical information to all the organs, such as the intestines, your sexual organs, bladder, in addition to, right, your legs, right? So now because it starts to misalign going backwards, take a look, see what it does. This tunnel starts collapsing, right? And when it starts going this way, see what happens to it? It collapses even more. Now, what happened was the fact that because this got damaged and the nucleus propulsus, that's a liquid ball bearing, is supposed to pivot all directions. But the containment band and its fibrosis, which is 25 of these fellows, it breached on you. So the surgeon, what they were trying to do is, okay, yeah, see that over there? It was trying to, right, exactly. They just trying to shave a piece of that fellow off, give more breathing room to that nerve there. However, they permanently altered the biomechanics. As notice, this thing is no longer pivoting smoothly, right? It's no different from like a patio screen door. You try to glide nice and well, it's not doing it anymore. and it's permanent because they suck some of the jelly out, not just once, but twice. Exactly. So I can't tell you how that thing's gonna heal up. We gotta take a look and see how it's gonna respond over the next several visits. I can tell you right now is because of how much they suck in, not just once but twice. That's what this one over here. That's supposed to be normal size.
Yeah, there is.
Right, 2/3 of it's gone already. So I'm just gonna let you know, right? The healing rate on this one is going to be much more lower than the average person. And this is the one we need to correct. Next one is the 6th dose over here for the shoulder problems.
Okay.
It's looser. Or loose.
All right. You mentioned about burning and also numbness down the leg. What's different about it now?
The numbness is still there. The burning one away pretty much.
Good. That's a good start. So, and here's the thing. Because you still have quite a bit of swelling over here. So, that swelling, that's what's causing the nerve to be compressed, constricted, and causing that numbness. I want you to ice this over here 20 minutes 3 times a day. As that swelling calms down, you'll notice the numbness will start getting diminished and diminished and diminished.
Okay.
Right?
Let it all go. A little more. A little more.
What up?
Oh yeah, nice. Feels nice, you know. Finally.
Good. How's the shoulders?
It's about the same. Little better, but the back is loose and nice.
Good. Your body needs some more time to regenerate, allow that nerve function flow into both your shoulders over there. Well, just for a bonus for the viewers over here, what we see here, okay, and he actually forgot about it. Tell us about that nose of yours.
I got hit with a ball, and when I was a kid, it just stayed like that.
Yeah, so as we can see the viewers over here, his nose got deviated towards this way, so we're gonna do our best try to realign it. But because it's been there since he was a kid, you know, there's no way to make that 100%, but we'll do what we can.
Yes, pretty better.
On which nostril?
On the left.
More clear, huh?
Yeah.
Yeah. All right. So once again, don't forget ice that low back of yours. Okay, it'll take the pressure off of that nerve over there, reduce the numbness over there.
Okay.
So that'll be it for today.
All right.
That's it.
Thank you.
Oh, you're very welcome.